Today, we're going to start off with the discussion of the abdominal pain. How it's a very common complaint when you're walking in the emergency departments. You would rather get a chance to see a lot of patients who come up to you with the symptomatology of abdominal pain, sometimes in an isolated case, and sometimes it is associated with multiple other symptoms as well. So knowing this condition and how do you basically go about and perform the initial investigations and obviously move towards the right diagnosis is very important part of the family medicine field. Now, when you have these patients of abdominal pain, it's very necessary that you know that there are a lot of organs that are residing inside the abdominal cavity that we're discussing today. For instance, we have the stomach, we have the intestines, the pancreas, the spleen, liver, gallbladder, kidneys. All of these can basically contribute towards this particular symptomatology. And then obviously, the neighboring cavities, particularly the thoracic cavity and the organs that are present over there, for instance, even a myocardial infarction would sometimes present to you in the emergency departments, and they would be basically just complaining of the pain in the epigastrium, and this would be the typical symptomatology that they would be having. And when you run the EKGs on these particular patients, you would find out that they're suffering from a lower MI infarct, or there are some slight changes in the EKGs, that is the ST elevations, they would be present in these particular patients. And then obviously the pelvic organs, they can even contribute towards this abdominal pain, particularly the genitourinary organs that are present in the pelvic region. Any kind of inflammation, any kind of torsions, they can even contribute towards this particular symptomatology of abdominal pain. So there is a wide range of diseases that can basically develop, and they give you a symptomatology of abdominal pain. And distinguishing all of these different clinical conditions is again very important when you have these patients. So there are two basic things that you'd be focusing on, particularly the site of the abdominal pain, and then obviously the nature of the abdominal pain. These would be the particular two factors that you'd be focusing on when you have these patients of abdominal pain. And again, you have to keep in mind that moving in the right direction when you have these patients is something that is very important, because you have to identify the life-threatening conditions for these particular patients.